the purpose of this week's strategy and the purpose of this week's workshop is to really start the foundation and to start to build on integrated vector management and what it means for the Department of CPS. I'm extremely grateful that this has been a priority set forward over the past couple of years, and now that it's actually come to fruition and realized, I'm extremely grateful to the support that CARFA has been giving collective prevention services over these past couple of months. I'm excited about the workshop. I'm looking forward to hearing different perspectives on how different countries manage their vector programs. And I wish everyone a productive week, and I'm looking forward to being able to pop in and out every now and then over the course of the week. But I know that with CARFA's leadership and guidance, we're off to a great start. So without further ado, I would just like to turn over the microphone to the Honorable Minister, Mrs. Pamela Gordon-Carty, to say her welcome and thank you, and good luck this week.
It's with great pleasure that I'm standing here in front of everyone tonight, this morning, sorry. I had a good night yesterday. Everybody enjoy Women's Day yesterday?
We sure did.
Was it? Huh? It was? All right. Good. Well, as Minister of Public Health, I am quite delighted to welcome everybody that is here, that took their time to either fly over or to attend to this session that is being hosted by CARFA. We want to thank you, CARFA, for that as well. And it's always good for us to keep and hold workshops because at the end of the day, we need to continue upgrading ourselves. We need to continue establishing and reinforcing those ties and relationship with our countries, our neighboring countries. So this workshop, I think, will do all of us well that is participating inside of it. And we are expecting that everyone will just walk out with more knowledge, experience, know-how, whilst we are exchanging information so each one of us can grow. In reviewing the week's agenda, I noticed that the objectives including in this workshop are strengthening our existing capacity and sharing lessons learned from CARFA and other islands that are present here in the week. So I expect that the workshop will be very interactive and that a lot of information will be exchanged, which is good. When information are being exchanged, it's always good because that means to say we are growing and we are improving. And that's always good for our country. So it is clear that the Sound Vector Control Program requires political will and leadership in order to respond effectively to the needs of preparedness, planning, and epidemic response. So in closing this, I would like to say that I am pleased to see that after several months of planning meetings held between CARFA and CPS, that it was realized that St. Martin was selected to be among the first member state country to receive support from a joint initiative between CARFA and the European Union for this work mission. I am looking forward to hearing the outcome of this week's workshop, and I thank CARFA once more for their continued support through this initiative in strengthening St. Martin's Vector Control Program. I wish you guys a very fruitful and efficient workshop.
It gives me great pleasure this morning to bring to you greetings on behalf of Dr. Joy St. John, Executive Director of CARFA. This week, CARFA will be collaborating with the Ministry of Public Health, working in the area of integrated vector management. Vector-borne diseases, generally, if you take a look, such as those caused by viruses and parasites, and are often transmitted to humans by mosquitoes, are a major threat to the health economies globally. Vector-borne diseases actually account for as much as 80% of the global disease burden, and they cause about 700,000 deaths per year. Over the last few years, CARFA has the Caribbean has actually seen a wave of mosquito-borne diseases across the region, starting with chikungunya first in late 2013, and that was actually detected in St. Martin. Later on, the WHO declared Zika being a public health emergency of international concern when they determined a causal link between Zika and congenital Zika syndrome in newborns, as well as other neurological disorders. The WHO recommended enhanced surveillance and research in order to mount aggressive measures to reduce the burden of disease associated with the Zika, particularly among pregnant women and other women of childbearing age. So basically, such epidemics show the need for robust regional health security systems, especially since many of our CARFA member states are dependent on tourism as a major source of revenue. Recently, within the last year, the Caribbean also faced another regional epidemic of dengue, and dengue tends to recycle every few years. So this is something that we need to be very much aware of, and there's a strong need to strengthen our public health workforce and our surveillance systems within the region in order to detect and respond to these various public health threats. Now, against the backdrop of Zika in 2016, the Council of African, Caribbean, and Pacific State Ministers requested engagement with the European Union in order to fund an urgent response to then Zika. This grant has been extended by the European Union, and collectively was about 5 million euros that was supposed to have been spent over 5 years. So phase one of that particular grant that we received from the European Union was completed between 2017 to 2018, and we're now in phase two, which extends from 2020 to 2023. So the primary goal of this project, as Minister mentioned, is to reduce the burden of Zika and other mosquito-borne diseases within the Caribbean, and work towards improving the health and well-being of our Caribbean people. So the project is very broad and far-reaching and utilizes both a multi-strategic and multi-sectoral approach, engaging not only public health, but also sectors such as tourism and education, and has a very strong focus on community engagement as well. In terms of an overview of the project, we're looking at 6 major outcomes. So we're working with our member states on various initiatives, for example, building country laboratory diagnostic capacity, strengthening in-country disease surveillance systems, focusing on community engagement and knowledge building, improving access to research and health information that usually is not available to the immediate public, working on improving partnerships with all our member states and our various international development partners across the region. And lastly, of course, the reason that we're here this week is working on our country vector control programs and integration of various vector control tools and technologies to counteract mosquito-borne diseases. So this week in St. Martin, we'll be holding a workshop, and the objectives of this particular workshop are going to include an assessment of the existing or potential laboratory facilities, specifically entomological facilities. We're looking at training vector control personnel in entomological lab techniques and looking at the collection of data for the management of Aedes aegypti mosquitoes. And lastly, we're going to look at developing and implementing feedback mechanisms for entomological indices and vector control operations. So at the end of this week, we're looking forward to producing a very comprehensive strategy that is going to be monitored and evaluated over time. And we look towards a very successful week working with all of you, and we hope that you will appreciate and integrate all the knowledge that will be gained here.